other key piece that I want to give you is about our shared governance model. Our organization is a magnet designated organization. We're magnet 4 times over, and we have a long-standing history of shared governance. And so one piece of our shared governance is our nursing informatics committees. So we have staff that are from each of the clinics, the operating rooms, the inpatient units that are designated to participate in our nursing informatics committees. We have 3 of those, one for ambulatory, one for procedural and peri-op, and then one for inpatient. And we ask those staff to come to those meetings once a month, and they meet with our nursing informatics specialists, our health IT analyst colleagues, our trainers, and other people to make decisions about the changes to the system, to give suggestions about enhancements that we need to make, updates that we're going to take, and to just give feedback, et cetera, on how we are using our technology. So those people that are at the front line are called E-Star reps. We call our system E-Star, so that's why they're called E-Star reps. But we had problems with not having a good way to really track attendance of those people. We had some areas where we had E-Star reps that really shone, they were really stars, and then we had other people that, or other areas that we felt like we weren't well represented by those areas, but we didn't really have data to say, you know, this particular group is not being represented at these meetings, and to be able to take that to our leaders. So that was one of the things I wanted you to keep in mind, because we felt like these were the people who really knew the workflow at the front line. And they were an untapped resource for us. So I'm going to tell you more about that in just a minute. So we knew we needed to make some changes. So we went to the Cotter model, and I know that was mentioned yesterday morning, which is a change model that we had used previously, and began to think about, so what are some of the things that we need to do to help us with creating a climate for change within our organization. So we already had an increased sense for urgency. I've told you all those reasons, so you know why we needed to make a change. So now we needed to build a guiding team, and we needed to get our vision right. So one of the things that we had done in 2019, we had collected data from our nursing informatics team about where were they spending their time, what were some of the problems that they were seeing, and so we began to have a retreat at the end of the year, and our mission, we began to develop our mission at that retreat. So once we got those positions filled, we came together and we developed our mission. So this is our mission, led by our core values of knowledge, resourcefulness, collaboration. We provide consultative services, applying nursing informatics principles that empower our customers to leverage technology and information to meet organizational goals and promote the effective delivery of safe, personalized care. So the consultative services is a big piece for us. We are really switching to more of a consultative versus a reactive kind of a service. Here are our core values: knowledge. One of the others, all the other support teams that we have are not nurses. So we are all registered nurses. Many of us also have masters. Many also are board certified in nursing informatics. All of us are also EPIC certified. So we're vendor certified. We believe strongly in collaboration and working with others, and also resourcefulness, being very flexible and able to respond in various different ways to the organization's needs. We had a leadership team that really helped to develop some of the model, and then we used our nursing informatics team, which we call Venus, for Vanderbilt Nursing Informatics Support, to help us with refine and to help make assignments. We also had a DNP student. I don't know if Brenda is in the room or not, but Brenda Kohanek was also with us and really helped us as we developed this model. So what is the model? So I keep talking about this model. So it is a shift to a consultative approach. So because consultants really provide expert opinions and recommendations to their customers. So that's what we were planning to do. And instead of being embedded at particular levels with nurses, we elevated a level. Our nursing informatics specialists were now going to be working with the leaders instead of being embedded at the level of the staff. We really wanted to develop our E-Star reps to be those people, those frontline folks. So here are the components that I'm going to talk about and go over those. So our team approach to support. So we developed a team mailbox, one for inpatients and peri-op and one for ambulatory. So in the past, when somebody had a question about something, it wasn't that something was broken, that went to our help desk. But if somebody had a question, I can't remember how to do this, or I need advice on this, or I need somebody to come to my unit and help us with this problem, they would just call whoever was on their person, their nursing informatics person. Well, that kept our nursing informaticists always putting out fires. And they didn't have time to work on projects. If they were doing support for something else, then it would delay getting back to these people. So we created a team mailbox so that we had people that were on that team mailbox that could respond to those questions right away. So that really helped us to be more timely in our responses, and we could track those questions, whereas the other method, we couldn't really track that. We also had our nursing informatics specialist assigned to our A&O levels, that's our administrative nursing officer levels, and they would attend the monthly meetings that they already had with their managers, and they would go and talk about what are some of the informatics initiatives, downtimes, changes that were coming, as well as get feedback from them about what were their initiatives, what were some of their problems that they were having to then bring back into the VNIC or Nursing Informatics Committee meetings. We created templates for presentations. We were really trying to step up our game and look more professional like consultants do. The E-Star Rep Enhancement Proposal was created. We actually identified 2 nursing informaticists to drive that program, Molly and Angie, and I don't know if you saw their poster presentation earlier today, but they really drove that program to, number one, increase the nursing E-Star reps' knowledge of what they were supposed to do. So we worked on their roles and their responsibilities, developed an orientation program for them, developed some lunch and learns to develop their skills and their responsibilities. And the other thing was that we developed a way to track their attendance. And we also wanted to assure, we had some leaders that were in those roles, and we wanted to have more frontline staff, people who were actually using the system on a day-to-day basis that were in our committee meetings and making those decisions. Because a lot of leaders, you know, though they try to fill that gap, they're not in the system every day using the system. We wanted frontline staff. So we actually then had transparency into who those E-Star reps were, and then we could, at those monthly meetings with our A&Os and our managers, be able to share that information.